Hello, everyone, and welcome to today's Dean's Roundtable from our College of Health Professions. I want to let everybody know that this program is being recorded for future use, and I know that a great many more students will be listening to this in the recording than who've been able to join today. It is great to see all of those here who could join today, and I'm so pleased to be introducing our speaker, Dr. Launette Woolforde. Dr. Woolforde is the Deputy Chief Nursing Officer for Northwell Health, the largest health system in the state of New York, and is an assistant professor at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Over her 30-year career, including 18 years at Northwell Health, she has served in various roles in the clinical setting in medicine, surgery, and critical care, as well as in administration as corporate director, vice president, and chief nursing officer. Dr. Woolforde launched her nursing journey in the Bachelor of Science in Nursing program at Pace's Lienhardt School of Nursing. She went on to earn a master's degree as an adult clinical nurse specialist and postmaster's certificate in nursing education, subsequently earning a Doctor of Nursing practice degree from Case Western Reserve University and a Doctor of Education degree from Columbia University Teachers College. She is the first nurse at Northwell to earn 2 doctoral degrees. An internationally recognized leader in nursing, she holds 2 board certifications, is an inductee of the Columbia University Teachers College Hall of Fame, a fellow of the New York Academy of Medicine, and a fellow of the esteemed American Academy of Nursing. Dr. Woolforde, a true and heartwarming welcome to our Roundtable series. We are so pleased to have you with us. At this time, I'd like to turn it over to you to share a bit about your experience at PACE and how it has been beneficial to your career path.
Well, thank you so much. It's good to be home at PACE. Thanks for giving me the opportunity to share a bit of my journey and hopefully inspire and encourage fellow PACE setters on their journey. So I always wanted to be a nurse, and I never really entertained anything else. So in high school, I pursued college applications to nursing. And interestingly enough, so I came across, that's how I learned about Pace University. I was really impressed with the program, and I wanted to go there. I said, I want to go to Pace. Interestingly, the guidance counselors in my high school were not as familiar with the structure of the PACE programs and directed me. I also wasn't very familiar, and they directed me to the PACE New York campus. And so my application went there, and it wasn't until after I started at PACE in New York City that I learned that I was at the wrong campus because they did not have the pre-licensure programs that I needed. So at that time, there were no further, the semester was underway. We had to pivot, right, as we do, pivot quickly to plan B. And so I took courses that were going to be necessary, but I didn't make any progress in my journey toward nursing because I wasn't taking any nursing courses. Fortunately, I was able to get up to the Pleasantville campus the following year as a sophomore. And so my time at PACE was intense because I went to summer school every summer to make up for that first year that I wasn't able to capitalize. At least at that time, I know programs have changed. And at that time, we started nursing courses as freshmen. You know, you weren't in the School of Nurse or at the university, but not in the School of Nursing. You were actually in the nursing program. And so I had a little catching up to do, but I was determined to do it. And I had great support while I was at PACE. So I lived in the Briarcliff campus and of course took the classes over at Pleasantville. I worked in the nursing lab. It's a far cry from the wonderful simulation center that exists now. But at that time, it was in a similar location there, but it was, we had about 2 rooms that had beds with mannequins that we thought were high tech, but they did nothing. And we also had a computer room. And the lab director, her name was Barbara Thomas, and I was a work study student. And so I spent my years there when I was not in class working in the lab. And it was very helpful because that's how I learned about Synol, you know, and I had the opportunity to interact with a lot of other students. So it almost reinforced, you know, my learning because as a student in that lab, I just was exposed over and over to learning and learning opportunities. And Barbara Thomas was very supportive and encouraging. Interestingly, I would be remiss if I didn't talk a bit about the culture that I experienced at Pace, which was, I think it was at the end of my sophomore year. And so I had financial aid, and I had some scholarships. That's what enabled me to be able to go to Pace. My family, we didn't have money. And so that was a bit of a hurdle that perhaps some folks can relate to. And so it was toward the end of that semester, and money was tight. And I think it was Barbara Thomas who said to me, you should go and speak to the dean. And I said, well, I don't want to speak to the dean. The only time you go to the dean's office is if you're in trouble, right? And so the last thing I wanted to do was talk to the dean. And she said, well, no, she could probably help you and help you figure out. I was a work study, student in the lab, and she said maybe she can help you figure out how we're going to get through the next couple of years. And so on the advice of Barbara Thomas, Ms. Thomas, I went to the dean at that time, who was Shirley Stokes. And we met, and I told her of my story. My parents had gotten divorced. There wasn't money, and I wasn't sure how I was going to be able to finish the program. And she said to me, you're a good student, and you should finish this program. We have to, let's work together and help you out. And it wasn't what I expected. I didn't know what to expect in going to meet with the dean. It was intimidating, as a 19-year-old student. And so the next meeting I had with her, she said, I've helped to identify some scholarships. I think you'll qualify for them. And, she gave me this information, and I applied for these scholarships with her support, and I was able to earn those scholarships. And that's what paid in great part for my tuition for my junior and senior year. And so I always say, I'm grateful for my experience at Pace, but also for Dr. Stokes, for Ms. Barbara Thomas, and how they saw something in me. I think that's important, right? Because it's powerful when people who are nurses and people who are practicing in these roles see something in you and think that you can do that too, and help you along that path. So that's what got me. Those were pivotal experiences in my time at Pace, and graduation was fantastic. We did start off with a much larger class than what we finished with, which I think is still the case in nursing, right? Nursing is not for the faint of heart in many ways. And so I went after Pace into a bedside clinical nursing role in medicine at a hospital out here in Long Island, and I enjoyed it very much. Learned a lot from my preceptors, but I will say that I learned pretty quickly that nursing was not what I thought it was going to be, meaning that I thought it was all caring, compassion, and and discharges, bye-bye, get well, and see you later. But it was really, a lot of hard work, a lot of commitment to ongoing and lifelong learning. Graduation was just the beginning. And one thing I did realize early on was that, number one, I wanted to have a bigger impact on patients. And I felt good about the patients that I was taking care of, but I thought that there could be more if I could work with other nursing students and nurses to help energize. And so instead of us talking to each other about the things we wanted to change, that we could actually work together to affect some of that change. And because I enjoyed working with students and with orientees, I embarked upon a career in nursing education. And that has taken me in many different directions, which I'm sure we'll talk about over the next few minutes in my career, all of which were rooted in a really solid foundation through my nursing program and through my first job as a new graduate nurse. I don't know if you want to ask more questions or if you want me to just keep going. It's up to you.
Very much up to you, but we would love to open up the floor for questions from our attendees. I know quite a few more students have joined.
Yeah, I think there was a couple quick issues with password that we are rectifying at the moment. But if you don't mind, I had a quick question, Launette. You talked a little bit around faculty being supportive and sort of looking out and trying to go that extra mile to help the student. where you are now with your staff, I mean, how, I would imagine that you have taken that lesson and applied it with your teams. How have you been able to do that?
Yeah, I think a lot of it came from that lived experience, right? I mean, when you don't know what you don't know, sometimes that can work against you. And so I would not have gone to the dean. I probably would have left the program thinking that I had no other option if it were not for the circumstance that I was in and the mentorship and support that I had from the director of the lab. And so, so yes, what I learned in this journey was that, number one, we all need mentorship and sponsorship. You don't know what you don't know, and that can really be career ending, or it can be decisive in one's life. And so finding ways to build relationships with people who are a little further along the way in life and in career than you are is helpful, and helpful at any stage of your career. At this point, I've been a nurse for 30 years. Who will believe that? Yeah, when I was at Pace, I was 5 years old. So, it's been 30 years since I graduated from Pace, and over the course of those years, those messages have become more and more loud and clear. And I do carry it into my practice, in my current role, so I guess I'll talk a little bit about what that 30-year journey was like, right? So like I said, I graduated, I went to work in a tertiary care hospital. I was a clinical nurse for several years. I had wonderful preceptors who taught me everything I know. And I say that because, my preceptors, for example, one preceptor, two preceptors that played significant roles. One who we are still friends, the godmother for her child, and that's because we were working together, in codes and everything while she was pregnant, and that relationship was, I knew that baby before that baby even entered the world. My other preceptor did things like, I'll never forget, I was off orientation and we were leaving, I was working nights, and we were leaving that morning, and she said, okay, this morning we're going to go and stop by the credit union. And I said, what are we going to the credit union for? And she said, you have to start saving money. And I was 21 or something. I couldn't think about saving money. That wasn't anything that was high on my list. And she started to teach me about credit unions and the advantage of credit unions. And I told her I had already, I had a bank account and a credit card, and she gave me the whole life lesson on starting small with small savings and how these things will make a difference down the line. And I didn't have those other resources in my life. I just didn't. And so I followed, her direction because I admired her so much. She was a great nurse. She knew everything. To me, she knew everything about the patients and every problem. And I wanted to be like her, and so when she advised me, I listened. And I think that's also really important. And so the lessons that I learned from some of my nurse preceptors were more than just around clinical skills. I mean, she and my other preceptor were certainly the ones who were there for me when, I distinctly remember, and all nurses, I think, remember some of their first experiences as a new graduate. And it was my first night off of orientation when a patient who had been known to us, patient who'd been in the hospital frequently, coded. And she coded, she had some developmental delays. And so communication was always, difficult. And she had come in that admission for a procedure. She was wearing a halo, which is a surgically applied device. And she had a feeding tube, she had a tracheostomy, she had a lot going on. And she had aspirated on the tube feeding. And they were both, they were there. One of those nurses was there with me that night. And I'll never forget that night. Fortunately, we were able to resuscitate her, and she lived and, went on after that. But I just say all that to say that my preceptors taught me about patient care, and those kinds of situations, but they also taught me about life. And I think that all nurses, especially new nurses, have that opportunity to align with someone who has characteristics that you admire. And you'd be surprised the wealth of things that you will learn, and the circumstances that it can help you survive and get through, especially in the beginning when it feels insurmountable. Like, you wonder if you made the right decision. You wonder if you can do this work as a nurse. And when you align with those mentors and preceptors, I think more often than not, you really do get a lot more than you bargained for. So I enjoyed working as a bedside nurse, but I also realized I felt like I spent a lot of time giving medications, and each medication was to treat an adverse or side effect of a really a side effect, not adverse, but a side effect of another medication. And I felt like I wanted to do more to promote health, than perhaps to treat illness, if that makes sense. And so I wanted to I want to become more knowledgeable about how I could educate patients and other nurses more about staying out of these situations, in the first place. The unit I was on, we did peritoneal dialysis on that unit. So many of the patients had end-stage renal disease, they had cardiac disease, post-cardiac surgery, fem-pop bypasses, the complicated kinds of patients, and diabetic, and all that's associated with diabetes late stage. And so I really wanted to try to prevent people from that experience. And so when I went back to school, I went to study adult health as a clinical nurse specialist. And that was a great decision because it really gave me a broad toolkit. Clinical nurse specialists are not as prevalent now. I think the care model has changed. We have a lot more nurse practitioners, which is great. But CNSs have a diverse portfolio that has to do with education, research, as well as clinical practice, and really can do a lot of care coordination and management. So after graduating from my master's program, I really then delved into education, and I knew I'd found my passion in nursing, and that was around professional development. And so I taught in LPN programs, I taught in BSN programs. I also worked as a nurse educator in the hospital, working with new nurses, putting together policies, programs, strategies, and became, that's when I really started to learn that nurses played a role in hospitals that I didn't even know about in terms of leadership and decision-making, and that the knowledge that I had as a nurse was really beneficial for all aspects of care delivery and healthcare administration. And that was a surprise. It's not something that I went into nursing for. I then went to, as was discussed, as Dean Tye presented, to postgraduate postmaster's study in nursing education, so I could really refine my expertise in the teaching and learning realm, curriculum development, and so forth, and continue to enjoy that very much. And I realized that nursing was going to be something that was not going to be defined by any particular parameters. It's not what anybody thinks it is. It's whatever you want it to be. The impact you can have on people's lives can be in the public health arena. It can be in quality. It can be in, education. It can be in professional development. The list goes on. And so after that, I was working at that time as a nurse educator. I think that's when I'd come to Northwell, which was about a little over 18 years ago. And I was working as a nurse educator and decided that I wanted to pursue terminal study. It was really, again, at the advice actually of a mentor who was a former dean of the postmaster's program I was in. And that's when I pursued my first doctorate, which was in organizational leadership. I was working as a corporate director for our health system. And then subsequently, I actually did both of the degrees at the same time. Not advice that I would give to any sane person, but just the way the cards aligned for me. And that's when I went to Columbia to really strengthen my knowledge around research and structure and process and health and behavior studies. So, my current role, I am the Deputy Chief Nursing Officer for our health system. This health system has almost 19,000 nurses who are among 85,000 employees. It's not a small job. There is never a day that is not filled with everything that you can imagine, whether it's patient-facing, staff-facing, or otherwise. There's a lot happening in a health system like this. We're constantly thinking about how we can do better. And I realized, it was in my doctoral program at Columbia, interestingly. I think it was, the first or second class I was in. And I forget what the name of the class was, but, it was around health education. And in the introductions, the professor made us all introduce ourselves. And then toward the end of the class, a couple of the students were making some comments. We were all talking and they made some comments and they said, boy, you're so lucky, to myself and a couple other students. And they said, you're so lucky because you're nurses. And we thought, lucky because we're nurses. I mean, whoever says that? And they said, they said, well, you understand all of this so much more with the whole health education and the patients and the families and the dynamics because you've been a nurse and you understand all this. They said, they wanted to be involved in healthcare administration and healthcare education, but not having a clinical background, they really felt was a disadvantage. And I've started to really appreciate that. I think you're right. What I have learned in my career as a nurse really is unique, powerful, and enables me to make a difference that many other people don't have the opportunity to make. And so I'm grateful for that.
Just a comment. I just wanted to say that my name's Elizabeth, by the way, Dr. Woolforde. Nice to meet you. I'm a sophomore nursing major at Pace. And I just wanted to just comment and say the things that you're saying are very inspiring and very powerful. And I really admire your work. And like you said, like you mentioned, you're saying really powerful things about medicine and making an impact. Sometimes it's not about treating illness, it's about empowering others and promoting health. And I actually was doing a lot of research with that my freshman year, and it's actually just really empowering. I mean, I don't really know what to say, but I just wanted to comment on that and say that it's very empowering and I look up to you a lot after reading about you on the website and seeing that we have similar interests and in where I want to be in life as well.
Well, Elizabeth, thank you for being brave and, coming off camera and making a comment. So let me first just congratulate you on your journey. And talking to you reminds me, of when I was a sophomore at Pace. It was a great year, just a great experience, and the time goes by quickly. So it's refreshing, to see you there. And I just want to perhaps say a couple of things, right? What do I wish someone said to me when I was a sophomore nursing student, right? And some of that might be that, number one, of course, be prepared for lifelong learning, right? Because as you think the program is hard now, and it is, but it just continues. If you want to be the best nurse you can be, you need to make up your mind early in your career, early in your life, that you're going to continue to study, that you're going to continue to put in relentless hours to develop expertise in an area that makes a difference for you. And I say makes a difference for you because no matter what you choose, what area of nursing, you choose to go into, you always want to go home feeling like you made a difference, and that you did a good job. For me, when I was a clinical nurse, my barometer of whether I did a good job or not was whether my patients asked me if I was coming back tomorrow. When I would round at the end of my shift and, okay, so I'm going home now, I wish you, whatever, if they were going home, I'd wish them well or tell them whatever it was I knew about their plan of care. And when they'd say to me, you coming back tomorrow? That's when I felt like I did a good job today. I made a difference in this person's life. And you need that because the work is hard. Right. And I think that sometimes students can be a bit disillusioned, about nursing and thinking that, it's just, I just follow doctor's orders, or I just need to, someone else is responsible for all these things. And I just always try to tell students and new graduates that, as the nurse, you are the CEO of the patient. You are the person that knows the most. It's very likely that you're the person that knows the most about the patient. You're the person who probably spends the most time with the patients. And you're the person that everybody comes to for every different thing about the patient, including the patients and their families. And so it can be very overwhelming. And sometimes you can feel like, it's too much. And in this day and age of data and information, the data is great, but data can also be more overwhelming. And so you want to find that connection to the things that fill your cup and give you joy and remind you why you came into nursing. And so for me recently, for example, even in this role, and I've been away from the bedside, from a clinical role for years, even though I was a nurse educator, which allowed me to spend a lot of time on units and with patients. I haven't been a primary nurse for a patient in many years, But no matter how many times I move around in this organization, even in this role as the nurse executive for our health system, I spend time in our hospitals. I was just at LIJ, one of our tertiary care hospitals, last week, and my philosophy, which I see is very much appreciated by the nurses and other staff, is that I spent some time with the nurse leadership team there, yes, because I need to talk to them and we need to establish our goals, make sure we're moving forward with some of the innovations and strategies and things we want to move forward with. But I spent the majority of my time on the unit with the clinical nurses, and we went room to room. We rounded on her, on her patients, on her assignment. We talked about her assignment. We talked about the strategies and the resources that the hospital has for her. I rounded with the PCA. We went into every room. The patients were so excited to see. I guess I picked the right day and the right PCA and so forth, because they were all so happy to see her every time she came in the room. They knew her name. She was a breath of fresh air to them. But I think I say all of that just to say that no matter what level of nursing you aspire to, I hope that you find what it is that brings you joy, in being a nurse. And when you find that you make sure that you stay connected to that. One of the patients that that nurse was taking care of it was a surgical unit, as a post-surgical patient. He had a pretty complicated surgery. In fact, he had been in 2 times in the past month around his surgery, and he started to talk to me about his experience. And one thing that is important is that we do make every effort to not make patients feel rushed, and so while she changed his dressing, he talked to me about his journey. And by the time all was said and done, I reached out my hand to shake his hand and, to tell him that I was wishing him well. And I hope that he made a full recovery, and he kissed my hand, and he said, thank you, for listening. I know you must be busy, and, it just meant a lot to me to have you here. But those moments mean a lot to me. Right. And so, that's just a word to the wise that it's going to be hard when you get started. There's a lot to learn, there's a lot to digest, but it does get better, and you can navigate your way through it using some of the resources that I talked about, and by staying connected to the things that bring you the most satisfaction in being a nurse. So I can't wait to see you out here at Northwell.
Thank you very much. Can't wait to see you. I actually am from Long Island, so one day.
I will not forget this conversation a little bit when you show up.
I will be reaching out.
Absolutely. I'd love that.
Thank you.
There's a question that came up a few times in the chat here, but it's about what particular project or initiative that you're the most proud of, or that's made the biggest impact on your career journey.
So that's a good question. I'm fortunate that I have a lot of things that I'm proud of. And I think in general, quite frankly, the thing that I think fills me with the most pride as a general statement is when I run into my former students, and they are nurses, in any capacity. They don't, it doesn't matter what role they're in, but when I run back into them and they tell me that their career has gone well, that they felt inspired or influenced, by their experience or time that they may have had, together with me. And that brings me great satisfaction and great joy, when a student says, you were tough, but because you were tough, I'm better. We're all going to need those nurses to take care of us. So that is very fulfilling for me. But so that's a general statement, is my former students make me very proud when I see them out and about. But a couple of things that are perhaps a little bit more direct. I'll share 2 things. One that comes to mind is from a clinical point of view and a patient care point of view, right? On the hospital side, we certainly struggle with hospital-acquired conditions. And so hospital-acquired conditions primarily include infections, and we're always working to try to prevent the spread of infections in hospital settings. And patients who are at greatest risk, include patients with indwelling catheters, whether it's a central line or urinary catheter or any other kind of line. And nurses play a significant part in that role because we're usually the ones who are providing care around, those lines. So I was the senior director at one of our tertiary care hospitals that had a neurosurgical ICU, and your neurosurgical ICU had a pretty bad problem with catheter-associated urinary tract infections, or CAUTIs. And it was the worst performing unit in our health system when it came to that particular hospital-acquired infection. And so I wrote a grant to the American Association of Critical Care Nurses for an academy program they were providing, and we were selected. So I worked with the manager and director of that unit, and I said, listen, this is the grant. This is, a little bit of what I wrote for the grant. So what I need for us to do is to partner to identify 4 clinical nurses, because that's the way this program works. And they're going to participate in this year-long academy that's going to help them learn about the process of change, tools for change, and they're going to drive our CAUTI reduction strategy in the neurosurgical ICU. So we picked the 4 nurses, and they come to my office, and I have the meeting, and I tell them about this, and they said, in no uncertain terms, that they were unhappy, that I had basically put in this unachievable goal of CAUTI reduction, and that there was no way that they were going to be able to achieve that reduction of 50% in the CAUTIs. They were just nurses, a couple of them were fairly new, where no one's going to listen to us, this is just, if you want us to do this, we will do this, but boy, there's no way we're ever going to achieve this. Our patients have neurogenic bladder. That's, these are neurology and neurosurgical patients. They need their Foleys. So after they got all of that off their chests, we then, pinky swear, okay, that's fine that you feel this way. I think we can do this. I'm going to help you. The ASN is going to help you, and you can do this. Fast forward, just to make it, I have to keep you here all afternoon to tell you every step of the details, but those 4 nurses turned out to be the most remarkable nurses. They're infamous at this point. One just wrote to me the other day because she now does some work. They still work here, but she does some work with the state. She won the AACN Nurse of the Year award for subsequent work that blossomed from this. But they transformed that unit from being the worst performing unit in the health system, as I mentioned, to the best, the most positive unit in our health system with the lowest number of catheter-associated UTIs. In fact, one of the things they did was they came up with a visual cue, right? And part of this was part of the curriculum that they learned about how to promote change. A visual cue, and we decided that this cue was going to be a sunflower. They wanted a sunflower, and in typical nursing fashion, they wanted a sunflower because it was yellow and urine was yellow, and this was about urine. And so we picked the sunflower and decided that every day that this unit, by the way, did not go, they would have a CAUTI every week. There was not a week that they didn't have some hospital-acquired infection. So we decided that every day that we were CAUTI free, we would put a petal on this sunflower, and it was on the wall when you entered the unit. A big sunflower, probably about 5 feet tall. So we started off, we ordered the petals. They were like felt petals, and it was great, right? We put these petals up, and they got a CAUTI, all the petals come off, right? And the sunflower is blank again, and then we start back from scratch. Well, the long and the short of the story was that once we started to get past 50 days CAUTI free, 100 days CAUTI free, 150 days CAUTI free, they went a year and a half without a CAUTI. We were ordering petals, at a rate that we had not imagined. But what they did was they transformed the philosophy around what nurses, could do. And they became really passionate gatekeepers that our patients will not get a urinary tract infection because of this catheter when they are here. And they were diligent about getting those Foley catheters out. I think the support that they had from myself, the other, leaders in the organization was very empowering for them. They knew that no matter what they said, we were going to back them up. Right. And if somebody tried to push back on them, that they were not going to be out there on their own, because they were doing the right thing, which was to try to prevent patients from having indwelling lines. So they went on, like I said, to become the best performing unit in the health system. Many other outcomes. They experienced an 85% reduction in CAUTI in that patient population, a very challenging patient population. We replicated it across the health system. It went, AACN adopted it into their national toolkit, and those 4 nurses changed the perception around how nurses can improve care for patients. And I'll never forget the day in the office when they really did not mince words at how they did not think they were going to be able to do that. So that's one really, and I was their coach. You know, I was their coach through the change management project, and that's something that I'm really proud about because it saves lives, you know, and makes a difference, and it shows what nurses can do. I think the other thing I'll just share that I'm very proud about was, you know, I spent some time on the board at the National League for Nursing. I did 2 terms as a board member, and I went to the board of the National League for Nursing really because as a leader of nursing education at my organization, I was I wanted to see the nursing students engage more in what was going on with patients. And I felt like sometimes I didn't know where the students were. We had good things. You know, when I was a preceptor, I would always, you know, take 2 students with me. Come on, I'm going in to do this. You're going to come with me. And sometimes the students just didn't seem to be as visible or engaged. And when I talked with some of the faculty, you know, the faculty would share that, look, they got, you know, 8 students or 10 students, whatever the number was, and they were doing meds today with 1 student, which meant that the other, you know, 7 or so we're working with nurses on the unit, but we're not really being directly overseen in their moment to moment by the faculty. So when I went to the National League for Nursing, one of the things I really wanted to do was to help to impact that experience of students and faculty, academic educators in clinical settings, and how we could really close what I thought was a pretty big gap with some of the preparation of the faculty who weren't as familiar with clinical education. They were well-intended, but, you know, not formally educated in this regard, et cetera. And we all know, especially anybody on here who's faculty, that you can be an expert clinician, but teaching someone else and really allowing them to adopt that learning is an entire different set of skills. So in any case, the long and the short of some of the outcomes of my term on the board was the CNECL exam, which is probably familiar to some of you, which is the Certified Nurse Educator national certification that existed before the CNE, but we created the CNECL, which is for academic nurse educators in clinical settings to help bridge, you know, some of the knowledge and skills necessary for success in that role. And because that, of course, has national and international impact, it's something I'm very proud of to have supported the profession, right, and future generations of nursing through that.
I have a question. Hi, Dr. Woolforde. My name is Julia Bear, and I was wondering, from your perspective, what are the most important questions that graduating students should be asking when they're evaluating job offers or a first, you know, hospital clinical environment for their training?
That is such a good question. So I think that something you really want to garner, how you choose to ask it is up to you, but something that you really want to garner is, how does this organization enable you as a clinical nurse to have your voice be heard? Because organizations that have a culture of shared governance, where clinical nurses in particular are involved in policy decisions, involved in practice and workflow decisions, those tend to be better environments for patients for sure, but better working environments for new graduate nurses, because you're able to express in a safe and structured environment that these are the things you need in order to be successful. When that doesn't exist, and the decisions about the things you need to be successful are being made by people who are not in your shoes, there sometimes can be a pretty big gap in what is actually provided and what new graduates actually need. You know, years ago, I think it was maybe, you know, 1975 or so, maybe 74, if I might think I stand corrected. Marlene Kramer, right, produced a book called Reality Shock. It's been a governing document, you know, in nursing for a long time. Pat Benner's novice to expert model was really kind of derived from some of this. And it really talked about then, at that time, why nurses are leaving nursing. And it's interesting that we're still talking about that today, just like we're still talking about hand washing. But it really talked about the phases of transitioning into professional practice, and that first phase is reality shock, and that new graduates are not prepared for, even at that time in 1974, for what they are going to be asked to do and what the role entails. And so I think the work is not going to change. Patients are sick. If they weren't sick, they wouldn't be in the hospital. So, there's no need to ask too much, about that level of decision-making about who's in the hospital and so forth. You can certainly ask so you understand a bit about the patient population, but what you want to know is, what are the tools and resources that I'm going to have to enable me to be the best nurse that I can be for these patients? And oftentimes those questions are in things like mentorship models. Is there a model in this hospital where I get to partner, with someone who can be a sounding board, who can help and who can guide me? Is there a residency or fellowship program, some sort of a transition to practice phase where, yes, I'm learning and I'm taking care of patients, but I'm also perhaps going to some classes and learning from subject matter experts about different complexities in patient care so that I feel better prepared. Is there a forum where a nurse like me who's new is able to express what some of the things are that I think would be helpful for me as a new nurse? And if the answer to all those questions are no, you might want to think about whether that's a great organization for you to start. Maybe somewhere further in your career, when you're more confident and competent, you can navigate, an environment that isn't structured that way. But in the beginning, it's really important, because that first year is a decision-making year for many new nurses, and a lot of it is contingent upon those factors. With that, I'll shamelessly plug that here at Northwell, we have a system-wide nurse residency program. So every site in our health system has this. All new graduates are automatically enrolled, and you don't have to apply. It's a part of the transition to practice. It's a year long. It's accredited by the ANCC, American Nurses Credentialing Center. And we also, in addition to the residency, have fellowship programs for areas that require a longer and more in-depth nature of orientation, such as emergency departments, critical care settings, and things like that. All of our hospitals also have a shared governance model. So it's a model where nurses are on committees, councils, and have an opportunity. It may not be you, right? Because I just told you there's almost 19,000 nurses in this health system, and I don't have the capacity to meet individually with each one of those nurses. But because we have an infrastructure, a council infrastructure, there is a staff nurse representative for each unit, and that nurse gathers the feedback of the nurses and other team members on that unit and is able to, through our kind of pyramid structure, take all these 19,000 voices and synthesize them down into, okay, here's what we're hearing. We're hearing very loudly that our new graduate nurses want more flexibility with scheduling. Okay, that's what we need to listen to, and that's what we need to address. There's no reason to talk about better patient outcomes if we're not talking about satisfied nurses, because one is directly, related to the other.
Thank you. That was very helpful.
You're welcome. They're interviewing you, but you're interviewing them is the message that all new graduates should bear in mind in those conversations. I would also say, as we're talking about, we had two questions here about transition and new graduates. Employers are looking for well-rounded, individuals. I've been so impressed over the years with some of the resumes that come across my desk with applicants for our summer nurse extern program, which is quite competitive, but it's a great program. And students are not just, you're not just your grade point average, right? So that's important, and that must be demonstrated. But equally important is, the totality, the well-roundedness of your presentation as a nurse. So I'm sure that there are discussions on campus about dressing for success and all those kinds of things. But in addition to that, don't underestimate the power of community service, of professional organization involvement. of continuing education for things that aren't required, but just demonstrating your desire to learn and grow. I mean, you can take a course, maybe you want to be a cardiac nurse. There's no reason you can't take an online course or webinar or something on cardiac care nursing. You don't have to be a nurse necessarily to do that. And what it shows employers is that you're a level of commitment that really helps to distinguish you from the pack. And by that, I say that because here at Northwell, for example, it's highly competitive. While the nursing shortage and these conversations exist, we know there's over 4 million nurses, out there. All of them might not be working in acute care, but they're certainly licensed and out there. And what we have a good problem at Northwell, which is that we tend to have many, many more applicants than we have positions. And so what ends up happening is that you really have to distinguish, if everybody's got a 3.5 and better, what makes Nancy nurse a better candidate than not Nancy nurse? And a lot of the time that really is in that full portfolio. Look at that. This Nancy nurse has done some work with Habitat for Humanity. Oh, look at that. This Nancy nurse is involved in a campus research study, just helping to recruit subjects. You don't have to be, a researcher, but it just shows that, it shows a level of potential that is distinct and really helps to separate, when those resumes get moved from pile A to pile B and perhaps the pile that doesn't get reviewed, you want your resume to be in pile A. And these are some of the factors that help it get there, because the competition is stiff. I'm going to tell you, students are applying for positions from all across the country. They're willing to relocate. They do a lot of things. And so you want to make sure you take advantage of building a well-rounded portfolio.
I have one, if I'm able to. I'm Imani. I'm a part of the FNP program and for the graduate program here at PACE. I went to PACE as an undergrad and then I returned for grad school. So I had a question about kind of like what you were just speaking about in terms of like being involved, because I'm very involved in my hospital. I'm a part of like the unit practice council, and I've done my clinical ladder, and I'm a preceptor, and I like to educate and I like to learn. So I wanted to know, like, how can I be more involved in organizations such as like I'm a part of the American Association for Critical Care Nurses and Society of Pediatric Nurses. So those types of organizations, how can like you be more involved in those kind of organizations?
Yeah. Well, first of all, good for you and congratulations on your journey.
Thank you.
That's fantastic. I would recommend, and I advise people on this to do this all the time. Oftentimes these organizations are sending out messages to the members about volunteer opportunities. Join a committee, a nomination committee. It could be a committee that's exploring a particular issue. Sometimes it's standing committees within the organization itself, so it could be their education committee that reviews content. Some of these organizations, many of them have journals or other publications associated with them. And so sometimes they're looking for reviewers, somebody who can review abstracts or just weigh in on opinions on that particular subject. And so I would encourage you to think about signing up for a committee, checking those emails. Sometimes it's down at the bottom. So it's just, you scroll all the way through and then you see when they're saying we're looking for members for this committee or that committee. I would say throw your hat in the ring. It really, you never know what's going to be on the other side of opening that door, but the only way to find out is to go ahead and sign up, and you would be surprised how one thing can lead to another, and it can really help to shape your career. It'll give you a chance to get involved with other FNP students and just other nurses from other parts of the country. And you learn and realize that you're all, some of the things that maybe you think are unique to you, that in fact they're not. It's happening all across the country. You might find yourself teaming up and partnering on something really important and special because you found that camaraderie in the group. And those sorts of things are what tend to lead you to do some game-changing work that really helps the lives of certain kinds of patients. I was recently discussing this with some other NP students who really found that common ground around sickle cell patients. They were just saying that in being involved in a particular hem-onc organization, that they realized that they weren't alone in how they were feeling about how we could improve the care for sickle cell patients. And as a result, they formed their own kind of group to start to look at and gather data and advocate, right? Sometimes you'll find that it'll take you to places like, Capitol Hill or Albany, where you're just advocating for a bill or some other action that supports the care of patients who sometimes can't represent themselves in those forums. So get on a committee. You're not going to do anything wrong, so don't feel you don't need to be an expert. Don't think that you need to, be a subject matter expert or a nurse for 20 years to be on a committee with one of these organizations. Start small and watch it grow.
Thank you. And you've done great work.
Thank you.
Congratulations on all you've done.
Thank you very much.
So off of the committee question, what top 3 committees would you suggest people on the call join, or organizations, professional organizations?
These professional organizations often have some kind of subject matter expert group where they're looking for, so for example, Imani, as she said, she's had some involvement with pediatrics and so forth. So oftentimes they're looking for nurses who have that expertise, someone who works with pediatric patients who can be part of a subject matter expert group that's reviewing something. It could be anything from test questions that organization is putting out for their certification exam. Sometimes you're a field tester and they just want to see how you respond to the questions because it helps them to redesign, the questions, item analysis, journey, things like that. So I think that those are always good places to start because it's subject matter that you're comfortable with, right? So, you're not intimidated by the idea that the committee is looking for someone to opine on, nurses' roles in caring for a particular kind of patient when you are doing that every day. And after you get through, that initial phase, I think then you start to maybe move up to more uncharted territory. And that's okay, but it might be more difficult to start at that higher level because it can be a little overwhelming by those who have done all those previous steps. So start by signing up for an education. Sometimes they're looking to develop core curricula, or other kinds of guiding documents, and they want a body of nurses to have reviewed this. And that's a great place to start because this is the work you do every day.
We have just time for 1 or 2 more questions, and maybe I can ask one. It's a challenging one. And we know organizations like Northwell that are leaders operate on very slim margins, and yet the whole country spends so much of GDP on healthcare compared to other OECD 20 nations with not as good outcomes, and it's so complex. But what do you think are the next incremental steps that we could take collectively, including perhaps in the political process at state and national levels, to be able to help move the needle to improve the situation in the US?
Yeah, it's true. And when we look at the data and the finances around how much Americans spend in the last 2 years of our lives, compared to the rest of the world, it's amazing. And the outcomes are not any better. There's a report called the Future of Nursing Report. It was produced, this is the 2020 to 2030 version, that we're in right now. And it started back in 2010 through the Institute of Medicine. And what it talks about in each of those reports, I would encourage all of you to review it, is what the priorities should be for nursing in the coming decade. And so the first, the 2010 to 2020 version really had a lot to do with nurses practicing at the top of our licensure because we can make a difference in healthcare, and this is going to be really important. And a bit about data and other things like that, managing data. But the current 2020 to 2030 Future of Nursing Report focuses on health equity. And it focuses on health equity because the reality is that we have a lot of good work that's going on. It's not necessarily reaching the people who need it most. And we're not going to really advance as a society or a nation until we start to focus on health equity. Preventative, more preventative care, less sick care and more well care. I think we were talking about that in the beginning of this conversation, getting out into communities and doing more screenings and other kinds of practices that keep communities healthier. And so nurses, I mean, I don't know who's better to do this than nurses. And so, so the report is very compelling. We can't think to ourselves that because a problem isn't in our family or backyard, that it's not a problem for us, because it is. All issues that affect all people, you know, none of us are spared. And so you know, when I think about what we need to focus on and how we're going to improve the health of our entire society, I really do think it has to do with gaining much needed ground in the health equity space, really addressing these, you know, some of them are alarming disparities that are really unexplainable, you know, except for factors that we keep dodging. And so we are the people who are going to make the change that we want to see. And for most of us, you know, this is what we want. We want a better healthcare system and a better health state of health for everyone. So I would say we got to roll up our sleeves and really focus on that and making sure that those who need it most receive it. In our next roundtable or something, maybe I'll talk a little bit about that, because we shoot ourselves in the foot in that space a lot, just by design. You know, we offer resources at places that are not easily accessible, you know, like a hospital. People sometimes are afraid to come to these public places. Maybe you're undocumented, or you're worried that, you know, if I come here, you know, there's going to be a bad outcome. It's during work hours, right? And you can't take a day off from work to do this because, you know, you need that money, or you have nobody to watch your child. We just don't think of all the realities that people deal with when we design some of these solutions. And as a result, it does not reach the people we want it to reach effectively. So that's our charge, I think.
Well, thank you so much for that very, very thoughtful answer. And it gives us all a lot of work to do together. We're about out of time. I just wanted to thank you again very much for your inspiring career and for sharing that with us, and to thank all of those who have attended and all of those who will be watching this as well. Thank you again.
Thank you. It's been my pleasure. Have a wonderful day, everyone.